So we're returning to part 2 of the book, picking up with chapter 13. Chapter 13 really focuses on the interdisciplinary team and how the team works together to provide the best care for the resident. And so there's one key area of chapter 13 that I want to pull out for you. As you read through that content, just try to keep this information in mind. I think it'll help you understand the chapter just a little bit better. So when we talk about the interdisciplinary team, what they're doing is they are creating a care plan. And that care plan is used as a guide to determine the best way that we will manage the resident and what we are doing for the resident on a daily basis. The way you do that is in the care plan, they first identify some problems that the patient is facing or the resident is facing. They look at the goals that they establish for that problem. They look at interventions, and then they reevaluate to see if it would work. So if we identify a problem, the first problem I'm going to identify is, and if I can write, that would help. They're going to say falls. This is a very common issue for patients in the long-term care setting. Lots of falls occur, and so it's something you're going to see pretty often. If I'm establishing a goal for this problem of falls, that maybe the patient is a fall risk, then the goal would be that the patient, of course, would not fall. So we're going to say no falls in 90 days, if I can write. So you're going to say no falls in 90 days. And so over that course of time, you would hope that using the interventions that we come up with, that the resident would not fall over a 90-day period. So what interventions would keep this resident from falling? So in the CNA class, we learned about the use of gait belts, right? So we use our gait belts on transfer. We've learned about non-slip shoes, making sure that when we transfer the resident, they have on non-slip shoes. We've learned about leaving the call light in the resident's reach, so leaving the call light within their reach so that they don't fall trying to reach that call light. And we know, let's say, that we will toilet the resident every 2 hours because most falls can occur when the resident is attempting to toilet themselves. And so if they don't have the call light to call you, sometimes they'll try to get up, go to the bathroom on their own. And I think it's something like 60% of falls actually happen in the bathroom. So this is what the care plan looks like. They identify a problem, and in this case we said fall risk. They set a goal that the patient won't fall in whatever set amount of time they prefer. And then what's going to keep that resident from falling? Using gait belts, using non-slip shoes, having a call light that's within the resident's reach, and then maybe assisting them to the toilet Q2 hours, which we know from our CNA program that we toilet every 2 hours. So that's what happens in a care plan meeting. And the interdisciplinary team comes together, so that may be nurses, CNAs, the physician may be there, the activities director may be there, the social worker. We all come together and we create a plan to basically best serve the resident. Once the plan is established every quarter, or maybe sometimes shorter, we will evaluate and we ask the question, did it work? And if it worked, that's great. If it didn't work, then we attempt to come up with new interventions for the identified problem. I would say most residents are going to have multiple problems that have been identified. And so this is just one example of what the care plan meeting is about and how the interdisciplinary team works together to resolve possible problems for the patient.